What's up, everyone? Welcome to another episode of the Real Fitness Podcast. We have a special guest today. We have Dr. Sasha Speer from Aurea Pelvic Health
Aria.
in Aria. And I asked her before the podcast how to say that. Aria Pelvic Health in Westchester. Very excited to talk about the topic of pelvic health, which is very unknown to a lot of people in general and even us fitness professionals. So good episode today, and we're going to start things off. Sasha, if you don't mind, just kind of giving us a quick overview of your background, what you do, who you work with.
Yeah, perfect. Thanks, Peter, and thanks for having me on today. My name is Dr. Sasha Speer. I am a pelvic floor specialist. I have my doctorate in physical therapy, and so I've been doing this for a long time. I finished school back in 2008, so you do the math. And this field has been really evolving, thankfully. So we help with bowel, bladder, and sexual function with all the things down there, but also a lot of complex back and hip pain. So who do we see? Well, everybody has a pelvis. But the people I think that are most aware of what we do are the pregnancy postpartum population for sure. And again, people who are in a lot of that pelvic pain because they've got to find an answer. So they will eventually dig until they find a specialist. And same thing with a lot of complex hip and back pain, because usually people will go everywhere else and not realize there's a huge missing component here with the pelvic floor.
Just a general overview. Who would you say are some of your most common clients that you see?
Yeah, so I would say again, pregnancy postpartum. So prepping people for birth so that they're less likely to have a major tear, that
Mm-hmm.
they push faster, and that they have more stability right after. So less likely to have incontinence, pain like that during pregnancy, and then also they feel like their body's actually pretty put together after pregnancy. And then postpartum, we rebuild. Women are in a brand new body, and we rebuild that body so that they can do the things they love, and then they're not as at risk for things like prolapse, which is where all the things start to fall through,
Mm-hmm.
or you're developing incontinence later in life, stuff like that. And then that's population number one. Population number two is pelvic pain. People go, "What is pelvic pain?" You guys are men. Can I swear on here or talk, openly? Yeah.
Go
Okay,
ahead.
great.
Yeah.
Yes,
So
Yeah.
it's
absolutely.
like the men that come in with burning balls, like
Ooh,
not comfortable,
burning.
right?
Yeah.
So that's something that men don't want to live with. Erectile dysfunction, we will see that, and that can be helped with this. And then other kind of pelvic pain would be any kind of groin pain. Women that will have basically burning vaginas. It's like the women's issue of that. And so oftentimes you can't even wear underwear or sex life, forget it. So we see quite a few people in that arena, and usually there the focus people are coming in because life is uncomfortable, but also because they're like usually their sex life is basically has come to almost a halt, or it's very very difficult because it's very painful. So
Mm.
we help with that. And I just want to make a side note here, because for women, pain with sex is like an epidemic that nobody wants to talk about. But I would say almost every woman we see, for whatever they're coming in with, that is an issue. And that's not something that like people have to live with. So it's something that's super easy to, I wouldn't say easy, but it's fairly straightforward to heal. And then the third population is the complex back and hip pain. So I love the spine. The back is like kind of my jam. I just think I love how complex it is, and just how, as somebody who's lived with back pain, I have a congenital abnormality where my spine is fused to my pelvis. And so in that quest of like finding something natural for myself, I've been able to really help find a lot for patients. And so I think that oftentimes the missing piece is the pelvic floor, because the pelvic floor, first of all, I think we haven't even addressed that. That is part of what helps hold our pelvis up. It's like, think of it, the trampoline at the bottom of your like that sits in your pelvis, of like a bowl almost. And then you've got your hip muscles on the outside, some of your back muscles, you've got some of your deeper abdominals, and you've got your diaphragm. Those form your true core. So a lot of times people don't even think about the pelvic floor because it's just something we don't see. We can't see it, right? So in that, it's usually something that there's maybe a pressure management issue, or some of the pelvic floor is holding itself too tight, and so it's really pulling on the actual bones of your pelvis in a different way and affecting the whole mechanics of how everything moves. So you're not going to get resolved to that hip or back pain without resolving what's happening at the pelvic floor. Does that help a little bit more?
Yeah, and that's a good
Yeah,
point,
definitely.
especially like because in the fitness industry, the core is always referred. People usually think the abs. They think six pack abs. So us as trainers, we take it a little deeper to just go, okay, there's a lot surrounding all that. That's the core, but we rarely, almost never get into the pelvic floor, which again, perfectly said, that's a whole part of the core, which is very important. But it's like when people can't see it, they don't think about it. And again, core nowadays is usually just another word for abs when people are referring
Yeah.
to that.
Yeah, and then we see a lot of people, so especially postpartum population, because it's like, I'm going to get my body back, you know, and then they're going into abs right away. Even we've had fitness trainers that do this, like people are following their videos because they don't know, right? And if they're actually causing more likelihood of ab separation, which is the diastasis recti that can happen from that. They're actually increasing their risk for prolapse, again, things falling through. They're actually creating or worsening symptoms of pain, of incontinence, so, you know, not being able to hold all the things back and not realizing that, again, yeah, that's something we really need to address. I think the core needs to be redefined, to be honest, because I've been in fitness a long time too. I'm an athlete, and it's like we all want those cute abs, you know what I mean? We all do, but in order to have those and also have function, because it's not cute to pee on yourself, you know what I mean? It's not cute to walk if you got back pain, and no matter how good your abs look, right? To really have that stability underneath and that solid foundation, there are other really important pieces of that, and the pelvic floor is a big one.
Would you say that's something, you have your kind of your target population? We're talking about, pregnant women, people who have issues like discomfort in their genitals and stuff like that. But outside of that, just in general, like for the average everyday person, would you say that pelvic health is something that, that you should maybe incorporate into your fitness routine, or make sure that things are kind of like a baseline level in a sense? Because there's baseline levels of, we're going to squat, we're going to do a plank, blah, blah, blah. But
Yeah.
we
Yeah.
don't get into
I
this
would say
baseline.
we don't need a baseline like what do you do with your pelvic floor? Most people can't even
Yeah,
find their pelvic floor, right? So it's
yeah,
just like, well, I'm going to do what now? And I can't see it. I think that like most people in their 20s, if you're not having babies yet, you're not having pain, you're probably okay. It's supposed to work. It works automatically. It also works voluntarily. It's one of those unique places in the body. But what happens is when we have injuries, so car accidents, major falls, so all you snowboarders out there, those kinds of sports, skiing, um, and a lot of times people forget. I have people like, oh, I lived in New York. I was hit by a cab. What? How do you forget that? But people forget. If you've had those kinds of injuries, or you've had a child, or you've been sitting now at a computer and you're in your 30s or 40s, you've been sitting at a computer for a decade or more, you're going to likely have pelvic floor issues. So that's the time to at least get a check, like just a checkup, and just really see your local pelvic floor specialist. Make sure they do internal work. If they don't do internal work, they cannot give you a full accurate assessment because they can't get to your pelvic floor. Um, but get an assessment and see, especially if you're still really active, you want to make sure you're not causing yourself more injury. If you've got hemorrhoids, you want to make sure that you're getting your pelvic floor looked at because you're probably pushing out your pressure management. It's probably off. And that right there, that's usually a pretty, again, straightforward fix, really educating and teaching your body to hold itself in a new way. I would recommend an assessment if you've had any of those major things I talked about. So that's the car accidents, major falls. Even if you were like 2 and you fell on your tailbone, that's going to show up later in life. If you've had a pregnancy, for sure, because it's probably off. And then if you've been sitting at a desk for years and years and years and years, even if you go to the gym, because there's certain things you may not be doing. So it's kind of the second part of your question, what should people do? There's some basic things. It's a little hard to show in my kitchen here, but there's some basic things that people can do to help with the pelvic floor. The biggest one is like posture is really connected to the pelvic floor because it has to do with how we hold ourselves. So like if I'm slouched over, I'm going to be compressing my pelvic floor. So that's if I'm sitting all day long. And then if I'm not standing up all the way, or if I'm not raising my arms above my head and utilizing that full spinal mobility, I'm going to be putting a lot of that pelvic floor. And then if I go to lift heavy weights, that's where we talk about the hemorrhoid thing, you're at a much higher risk because you're already towards the end there, the pelvic floor with that trampoline. It's already loaded of not being able to support. And then you've got something annoying like a hemorrhoid, right?
hmm
That's a simple example. So really focusing on postural activities is important. Really connecting to that pelvic floor. Like Kegels are one of those things that aren't really super straightforward. You've got Kegels that if your pelvic floor is in a great position, they're okay, but some people hold them too tight. So a lot of you Pilates people out there, for instance, that's a great population. People will come in and they're too tight. So that's where you're having issues more with painful intercourse. You're having issues with might be peeing too often, those kinds of things. You need to learn to relax, not do a Kegel. For someone who's just had a child, most often you need to be able to really find that pelvic floor. And
Hmm.
then a third, I'm going to do a third and a fourth piece. Third piece is the transverse abdominis. So this is what acts as like our corset through here that helps support our nice, beautiful abs on top of it, right? And without that having good stability, especially postpartum, you've got women who are more likely to have those abs start to separate. So you've got to activate that. And that's just done through a really simple like breath. And if you can bring that top of the tummy straight back without the chest rising, that's the transverse abdominis. If you're on your back, it's keeping your back nice and flat. Again, without that chest rising, that's your transverse abdominis. And then the fourth piece is breathing, because you want to make sure that diaphragm manages pressure. Think of it like a pump. It goes up and down. And if that pressure's off or that's weak, your pelvic floor is going to be affected. So really making sure you're taking nice deep breaths. And there's no one right way to breathe. I teach a 4-7-8 breathing technique because a lot of our people are also really stressed. We live in LA too, so there's just a lot of traffic. There's a lot of things happening. There's a lot. It's expensive. So I find that most people need to bring their nervous system down as well. So I'll just explain that. But it's breathing in your nose for a count of 4, holding for a count of 7, breathing out through pursed lips for a count of 8, and doing 2 to 4 rounds of that, and that will calm the nervous system. And then you're going to use your whole diaphragm. But people also do the 5-5 breathing. That's okay. What I don't want to see people doing is anything, especially postpartum, that's opening the abs up here. Because again, if you've got diastasis, it's going to make it worse. That's not going to lead to true stability. And it's not going to really help your pressure mechanism. So you want something that, yes, expands the ribs, but is not necessarily opening up this top space here in the abs.
So you were talking. Well, first of all, I'm very curious. I don't know what you meant by burning balls. So is that like a gonorrhea? Are you talking about gonorrhea thing
No,
or some sort of
no.
a
So when the nerve gets irritated, the pudendal nerve is the main nerve through the pelvic floor, and in men and women it shows up a little differently, but it literally feels like your balls are on fire, but it's a nerve irritation. And in women,
Mm.
it feels like the labia are on fire.
Mm.
And
No
is
good,
there
no
any
bueno.
there's no like exercise that you would recommend that would address that?
Most of the time for that, so in pelvic health, again, it's like ideally you get an accurate assessment. But if you're somewhere where you can't get an accurate assessment or whatever, what do you do? So in something like that 4-7-8 breathing technique I just gave is huge, because usually in those cases the pelvic floor is squeezing, and it's squeezing and basically suffocating that nerve. And so that's oftentimes in cyclists what we'll see. So that's like if they're sitting in the wrong type of saddle, and they'll get that from really long rides, and then it just won't go away. So really working with the nervous system, because we've got to calm that first, because it gets stuck in a loop of just being tight and then protecting itself and tight and protecting itself, and we have to like come in beyond the brain and say you're safe, like calm down. So a lot of pelvic pain is really teaching that neurological component as well.
Just a way of just relaxing the area, sort of
Yeah, but most of us,
between the
again, we're not in
thighs, kind of
tune
thing.
with it because we can't
Yeah,
see it, right? And it's also
yeah.
a muscle, like I was saying, group of muscles that work involuntarily and also voluntarily, but usually you don't need to voluntarily access them much until something goes wrong. So that's where we use the breath as basically it's a hack to get to the pelvic floor and teach it to chill out. And it goes beyond the brain, because oftentimes we can't think our way to it. We have to get at it neurologically.
Got it. Now, for trainers, is there? I don't know. See if I can put this in a way that makes sense. Is there a visual issue, a deviation that you want to look for in certain movement patterns like
Yep.
squats? And I know you had
Yep.
mentioned sort of this leaning forward, but like when we see something like that, what would you say is a deviation off of a proper movement pattern in like hip dominant and knee dominant? I would assume movements
Sure. Well,
that
if
would
they're not
signal.
bending, yeah, if they're not bending at the hip, that's huge. A lot of people will, especially that are really disconnected from their bodies or they've had an injury for a
Yeah.
while, they'll move from like the mid back forward, but they're not moving. They're not have no lumbar flexion extension.
sorry, this doesn't move. It all comes from
Yeah,
here.
yeah,
And I'm
yeah.
trying to
So
do like hinges, like tap your butt to a wall and, you
yeah,
know,
and that can be a sign. So in a woman, especially like you, there's some like signs we look at postpartum and or if they're in their 40s or 50s, that can be a sign of beginning of prolapse because why are they moving that way, right? Are they avoiding? Is there already pressure in their lower abdomen and like they're moving in this way to kind of avoid that subconsciously, right? Um, did they have a back injury? And that's why things are, they just never learn to move properly after that. So I would ask a few more questions from there and kind of see, what their symptomology is. But most likely there's a pelvic floor issue with that type of movement. Same thing as it can show up at the knees. So really not being able to sit back, right? So they're leaning forward more on the knees there. If you're talking about a squat. And then breathing, I think, is a huge one because again, it's the pressure management. So unless they're lifting, like unless they're a power lifter and they're doing that powerful weight where they have to hold their breath, if they can't breathe through emotion, and especially if they don't have really shallow breaths and they can't really get in tune with their breath, there's probably something going on with the pelvic floor there too. Because if you think of it like a potato chip bag that we're managing, if the bottom part's kind of blown out, so to speak, you don't really have any pressure and you don't know how to manage that because you don't have the support on the bottom.
now would you recommend like certain mobility drills, like a frog stretch or some sort of maybe a lateral type of frontal
Yeah,
plane type of movement to help open that area up?
sure. So there's two parts that are like to the foundation of our pelvis, right? We've got the pelvic floor, that's the internal component, but then we've got all the hip muscles and the muscles that attach to that. So some of the back muscles, some of the abdominal muscles, that's our external foundation. And I feel like in a gym, more often than not, that you're going to be working on the external foundation because again, you can't see the internal and it's hard to kind of truly like see what's going on there. So if you look at hip flexibility, we really need to be able to have flexible hips. If we don't, a lot of that pressure, our pelvic floor is going to try to pick it up. We need to have strong hips, again, otherwise the pelvic floor is going to try to pick it up. They're super linked and they're all part of the same kind of electrical grid, so to speak, too. So a lot of hip muscles also will light up the pelvic floor. So if it's weak, by default, you start to get some strength there too. So I would say, like, if I'm just going to give just a couple, I would say that like a piriformis stretch. So if you're on your back, I should have done, sorry guys, I'm like not prepared to like on my floor here today, but um, bringing your hip, pretend I'm on my back and you bring your hip towards your opposite shoulder. Opposite shoulder, not the same shoulder. Some people can't do it. You start them with the same shoulder if they can't do it, but to the opposite shoulder, they should feel it right in the middle of their rear to get the piriformis there. Other leg should be straight, so flat on their back. That is so important, especially if you're doing a lot of like external rotation and power moves. Usually the piriformis will be really tight. So
It's a
really opening
variation
that
of
up.
the what is it, the pigeon stretch? Is that kind of like is that what that stretch is called? I think people are doing it all the time,
Yeah.
right? But it's that variation of that, right?
It's a
The pigeon.
variation. It's a
Yeah,
variation.
yeah.
It's more targeted. Yeah, because the thing with hips too, like the body, you got to get specific. And our bodies are really good at compensating. So if we're already weak somewhere, we're just going to compensate. So instead of like moving here, I'm just going to move out here and stretch, right? Whereas I need to move here. But if it's pinching in the front, that's a whole other thing that a PT has to deal with. But that's a good one there. Hip flexors are super important as well. Again, a lot of sitting jobs. So you're going to be really locked up and through here. And if you're locked up there, you can't have a lot of mobility through here because that's stopping you. So that for a hip flexor stretch, I usually do it standing, putting the leg behind you. I'll show you here. Sorry, I'm in my sweatpants too. I thought I got to get away with that today.
No, you're good. It's a fitness
That's
podcast.
right,
That's
that's
the problem.
right.
I just
It's
got out
all
of the
good.
ocean. Yeah, I just got out of the ocean, so I'm in my sweat.
Perfect.
So here, and then you're taking the tail and tucking it in. So I don't know if you can see, but my foot's on a chair here.
Move. Oh, I was gonna say if you move back just a little bit, we'll probably see a little bit more of you.
So like a Bulgarian split squat style, like one foot's elevated behind you.
Yeah, can you see?
Okay.
It's right here. Yay! And then
Yeah.
I've got my toes down, and then I'm doing this. And then you'll feel that usually through the quad as well, but that's a great hip flexor stretch. And then you
Got
can
it.
kind of do some side to side gently as well and get a little, because muscles don't just go in one direction. They go in all
Mhm.
different directions. So it's super
Mhm.
important that we have our static stretch so that it actually lengthens, but also that we're doing it from different angles.
Mhm.
And then you can do some dynamic stretching too, just the goals are different.
And
You
do
can
you
swim,
recommend
recycling
like
bin too. Look at
mini?
that.
Do you recommend mini band working, lateral movements and marching and all of that stuff to help strengthen the pelvic floor?
You mean like some of the stuff we were doing in the workshop the other day?
Oh, I had to leave a little early, so I wasn't there for that stuff. But
Oh,
yes, sorry.
yeah. So
Good.
that's just really really specific, right? And it's
Yeah.
hard on like this, like a digital platform.
Yeah.
And here's the thing I'm going to say. It's like it's don't be following something unless you live in the middle of nowhere and you don't have access. Please don't try to fix yourself if you've got a problem through YouTube or through Instagram. Like I get so many people that are more injured from that because you can't see. It's hard for me to even see in myself movement patterns that aren't correct, right? You need somebody who can see, who can give you that feedback. And so maybe bring that, even if you don't have a PT, bring it to your trainer and say, hey, am I doing this right? You really have to make sure the pelvic floor and the true core are so subtle. It's not a big movement. If you're doing a big movement, you're probably doing it wrong. They're so subtle. And so you really need to get at the transverse abdominis. Am I just bringing that in a hair? Great. If I'm doing this thing, I'm doing too much, right? So that in a hair, and the pelvic floor should come up just a hair, and then I should be able to talk and breathe at the same time. In the beginning, you won't be able to, but those are like the three key elements you need to be able to work together to make sure you're strong. But sometimes if you can't get to that, or if you don't know, start with some hip exercises. So I just showed you some stretches. Can I show one strengthening exercise that's super key?
Yeah,
Yeah,
sure.
please. Yeah.
So anyway, we're doing this on a Sunday for anybody watching. So we're all at home. At least I am. All right. So hip abduction. It's your glute med. So this is under like the booty one. It's right under that. We want to access that. So I go back at like a 45-degree angle. So I'm not straight back is glute max. Straight out to the side, you're getting a little bit of glute med, but you're usually cheating with some of the front muscles, so some of the hip flexor usually. So I go back at that 45-degree angle, keeping the toes. We're going to go back so you can hang out with my dog food in the recycle bin here. So you get some of that here. So you're back at that 45-degree angle. Toes stay forward. They're not out to the side like this. Okay, and that here, you're working the standing leg. You're also working the leg that you're moving and getting that key strength. You may find that you're doing this. Your glute med is weak. And if that's weak, your pelvic floor is going to shut down. You're also going to be at risk for back pain later on because it's going to affect how you walk and how you move, how you do a squat, all those things. So these are like the smaller muscles that may not be as exciting to work, but they're so important in order for us to have real, true fitness that lasts, if that makes sense. Because we're not sexy if we don't have good posture. We're not sexy if we're hurting. Does that make sense? And so it's important to recognize that these are really, or if we're peeing our pants, right? So these are really important pieces to the puzzle in order to make sure that then we do those bigger exercises, we get those physical results on the outside. You're like, oh, like I feel good too. And you can tell like how I'm moving looks good. Does that make sense?
Then riding along with the on the topic of pregnancy, because that is such a huge, I'm sure you get, that's probably one of your number one clients, I would guess, or just a big part of your clientele is post pregnancy. And at our gym recently, we've had, I want to say there were 6 babies born in the last 2 months. So, and we've always had a lot of women who've trained in both our group classes and private training, pretty much all the way up until giving birth and then coming back fairly quickly. Now, in kind of a very condensed, generalized version of your advice for women who are going to work out throughout their pregnancy, who are going to continue on, what kind of general advice for that, and then also coming back post pregnancy on both ends, what would be your kind of like your bullet point fitness tips, I guess?
Yeah. So pregnancy, I want to just say one thing too. A big reason we see pregnancy postpartum is, first of all, there's finally more awareness. It should be standard practice for everybody having babies. It's just a better experience overall because having a baby is a trauma and it really disrupts your body. And so when you can stay ahead and minimize the trauma and then rehab from the trauma, you just have a better outcome. But also a lot of people think that the only people that have pelvic floors are women and or people having babies. And so everybody has a pelvic floor, and so understanding that there's certain things that aren't normal and that people can get help with is important. But then coming back to your pregnancy postpartum, as far as fitness goes, I think it's awesome when people can stay active up until, at least the last few weeks before they give birth. But sometimes you're putting yourself at more risk there as well. So you really have to listen to your body versus muscling through it. And again, I can say this, like, as an athlete, I'm somebody who's done a lot of sports where you push really hard. When you're going through something like a pregnancy and you're stretching out, so that transverse abdominis we're talking about bringing in, well, when you got a baby, that's all stretched out, right? Your rectus abdominis, which is our lovely abs we all want to see, are stretched out. And again, it's hard to tell if they're separating ahead of time, but they could be separating. Our pelvic floor is usually either really tight or it's usually a little off or shut down, depends on the person. If you're still pushing yourself through all those things, you're potentially making that true core, you're potentially injuring it further. So you just want to be careful and listen to your body. If you feel good, you're probably okay. But if you're like, oh, this doesn't feel right, follow your body on that. I wouldn't be doing really, really deep squats, right? Those last 3 weeks, especially 3-4 weeks, wouldn't be doing really, really deep squats. I'd be checking your blood pressure twice a day, because a lot of people end up with high blood pressure and then you're exercising and making it more dangerously high. I wouldn't be doing a lot of jumping stuff, because you just don't have the support for jumping, or one-legged, so running. Unless you're a pro athlete. If you're a pro athlete and you also have the trainers and stuff, it's different, because you don't have usually the luxury of not doing certain things. But unless you're a pro athlete, be kind to yourself so your body lasts you the rest of your life. And we also want our pelvic floor as a woman to open up so you can give birth if you're going to have a vaginal delivery. So you don't want it too tight. So you got to be careful you're not doing too much those last few weeks, especially causing it to tighten up. When to see a specialist if you're having back pain, incontinence, and then to see a pelvic PT, I would say OB, you need to see your OB if you're swelling up really bad, or if your blood pressure is really high. Those are really key things to be monitored. That's pregnancy. Any other questions with pregnancy before I go into postpartum? No?
Yeah, no, nothing else off that I can think of off top.
Okay, cool. And then postpartum, that's where you have a woman has a whole new body, and she thinks it's the same body. I'm just going to get it back really quick by working out. I think the old me that was an athlete before PT school would have thought that, right? And it's like, once you know what you know, you're like, oh gosh, absolutely not. You have a whole new body. It doesn't know how to work yet. So I think one of the analogies I give is, like, if your pelvic floor is a part of a football team, right? And that football team also includes that transverse abdominis we're talking about, the diaphragm, those hip muscles, everything's got to work together. After a baby, you've got half of them in the locker room, the other half are on the bench. The ones that are on the field don't know what position they're playing. So you've got to have two things happen. You've got to get everybody out of the locker room and off the bench and onto the field, but then you got to teach them what position they're playing. You can't have 4 quarterbacks. So the body is going to be really good at compensating and pretend it's playing football, so to speak, right? But then you've got 4 quarterbacks running around. That's never going to work. So really easing back into things and getting those deeper muscles on right away. So some of those exercises we talked about earlier, transverse abdominis, breathing, again, it's subtle, but it's super huge. Some Kegels, again, it's not as straightforward as that, but if you've got other resources, doing some of those and then trying to do them together is really key. Can you work all of those together before you're then going into things? And then I wouldn't be doing any jumping, any running, anything that's a one-legged activity where you're weighted a lot for about 12 weeks afterwards. You're just not strong enough. Even if you feel great, that's where I see people that go right back into stuff. They start to develop the diastasis if they don't have it already. They start to prolapse a little bit. They start to develop incontinence. You don't want to develop these problems. There's a symptom threshold. I'm almost done. I'm on my little soapbox. There's a symptom threshold. Normally we're down below the symptom threshold. But what happens is that when you have a child, you're either right underneath that, you come up, or you're just past it. But usually where it's more dangerous is if you're right underneath it and then you go do a bunch of jump roping, you're going to be like, oh my gosh, why do I all of a sudden have all this heaviness in my abdomen? Or why am I all of a sudden peeing my pants? I don't understand. Or my hemorrhoid came back. Like you blew out your pelvic floor, so to speak. And so you have to bring that down to a safe area before you then challenge it so that you've got a lot more wiggle room. So Those are kind of the nuts and bolts there. I wish it was a lot more straightforward, but basically get that internal foundation first, then your external foundation with the hips and the back muscles, then go back into your bigger activities.
Yeah, you mentioned single leg exercises. Is that even body weight single leg exercises? You would still say just weight.
Heavy lifting. So like I wouldn't be
Got you.
jumping on that one leg. So I wouldn't be running.
Got
I
it.
wouldn't be jumping. I wouldn't be jumping at all. So no jump roping, anything like that. And single leg, you're fine if you're doing stuff like some of the leg lifts I'm showing you, or some real light little squats. Wouldn't be doing any deep squats. I wouldn't be really holding a lot of weight because your pelvic floor, it's weight. It's not ready then for that. It's a more complex activity than a two-footed activity.
Gotcha.
Now, for these kind of like internal foundational movements, working on the transverse abdominis, some of these like the glute med exercises, what would be your time? Like, are these things you would say that, like, how soon could a woman post pregnancy start to work on things like that?
You usually after the first couple of days, I would give yourself a couple of days, especially if you give a vaginal delivery or C-section. You might even need a little longer because of the surgery. But let yourself relax and get some rest. And then after a couple of days, I would start gently into those and just trust your body and see how your body feels. All of those are, again, most of them are neurological exercises. So there's neurological strength, which is waking up the circuit board, so to speak. And then there's true strength where you actually have growth in the muscles. You guys do a lot of that true strength. Right? And a lot of rehab is the neurological strength. It's like, hello, wake up. You got to participate in the team. Here we go. Stop napping, if that makes sense. So
No,
a lot
for sure,
of these
yeah.
are serving that purpose postpartum of like, come on, here we go. But you also got to give them a break first.
Now, what about doing like stretching, mobility work? Where would you say that falls into? When could you do that?
Stretching is usually fine right away again, unless you've got a diastasis. So if women aren't sure, I would have somebody check you. If you don't have anybody, it's like you put three fingers with, if this is like where your belly button is, and you're crunching up and seeing if there's a hole there, basically. And so when you're checking that, it's a little hard if you don't have the experience to kind of check it. But if your fingers aren't falling in, you don't have a diastasis, you're probably okay. Don't overstretch though. Gentle stretching, especially those first couple of weeks. That's usually just fine. If you've got a diastasis, you don't want to do anything that's really opening up through the abdomen, because you're going to, again, separate it. If you think of it like the super glue has to set, you need to keep the glue together, if that makes sense. So I wouldn't be doing like giant cat cows or anything like that through there.
Mm-hmm.
I wouldn't be doing a lot of like one-sided, yoga stuff.
Now, I want to say, I remember, I feel like you told me when you spoke before, walking, you said, is something that's good
Walking,
for the
walking is
pelvic
one
floor
of
in
the
general?
most, it's good for the body, and a lot of longevity studies as well. Like walking is one of the best things we can do for our body. It's great for our back. It's great for the pelvic floor. It's great for the heart and the cardiovascular system. It helps to get circulation, as far as pelvic floor speaking, through the pelvic floor. And so you get some of the toxins out, you get some new blood in. And I mean, I've had people come back from Europe trips, for instance, and the only thing they changed, they started walking 40 minutes a day, and they feel so much better. A lot of their pelvic floor symptoms are being lifted. So walking, in LA, it's hard because nothing is like by each other, right? We're in a car a lot. But if you live in a city where there's walkability, walk, if like I'm from the country, walk those country roads, If you're in LA, like get on a treadmill if you're not comfortable going outside, but continuously walking. Postpartum, you may not be able to start with that 40-minute, but you can probably start with 5 or 10 and then take a little break. And worst case, usually what I'll do is I'll start somebody on like a 10-minute walk. And once they start feeling good, we'll do 2 of those in a day, and eventually maybe 3. And then eventually we start to lengthen those out. And so you're doing maybe 2 20-minute walks in a day, and then you try a 30-minute, then you go to 40 minutes. So you're gentle, but you're getting that input. Our body's all about patterns. And when we have good patterns, they're reinforced. But when we have bad patterns, they're also reinforced, if that makes sense. And so that's where it's so specific, is like we don't realize sometimes, especially if it's subtle, where we've developed a bad pattern and we're reinforcing it. So we've got to then take it over here and give it that new pattern. Again, that's the new football team, and all 4 quarterbacks, giving 3 of those guys a different position. So, and then we've got to develop that new pattern. And so it's looking at what patterns are you establishing. If we're talking about postpartum, what patterns are you establishing postpartum? Walking is usually a very good, gentle pattern. Again, it's going to help with a lot of the strengthening naturally. And then a couple of these other small activities, and then you're working with your trainers, and you're getting stronger and stronger. And then you do the big stuff once you've got the solid foundation there.
Now for someone, and it's pretty common. We're in LA. A
Yeah.
young woman gave birth, and she's like, "I got to get my body back. Walking's cool, but I got
Yeah.
to step it up. I need more
Yeah.
cardio than that. Like, let's
Right.
say like a Soul Cycle class. You know, something like you're on a
Sure.
bike, but you're going hard. You're really getting your heart rate up. What would you say about the higher intensity forms of cardio post
Yeah.
pregnancy?
I would ease into that as well, though, again, because you just don't have the pressure management for the breathing of it alone. What breathing, again, like we've talked about, is really linked to the pelvic floor. And so if your pelvic floor is all, like off, basically, and you're going to do a bunch of hard breathing, you're going to potentially, if you've avoided already the prolapse and things like that, you're going to potentially become at risk for that by coming closer to that threshold or passing the threshold. So I would ease into those tough classes. I would make sure that you're breathing and not holding your breath. So you really want to avoid any of those like where you're just holding your breath for things. You know, just I wouldn't be doing any of that. I would I would make sure that you're in the saddle and out of the saddle, so you're not irritating your nerves, but that you're not out of the saddle the whole time either, because you don't have the strength for that yet. So I'd
Mm-hmm.
be easing into that. I wouldn't be getting on a bike other than really light stuff. Again, the first few weeks is fine, but if you really start to push it, I wouldn't be pushing it till about 4 to 8 weeks out, listening to your body, and I'd start again with like 10, 15 minutes, because what happens is, and I think most of us are vain, right? We all are vain, right? We all want to look really good. Yes. So, and we should be, but you have to look at the bigger picture of there's your body right now, but then there's your body with a prolapse, your body when you're peeing on yourself, right? That's not sexy. So you really have to like make a choice of, okay, this might be, I might have to go a little slower, but I'm avoiding these things that really aren't going to make me look or feel good, if that makes sense. So,
Mm-hmm.
um, those high level, and so I would say biking is probably okay, but just be gentle. I wouldn't be running right away. Again, I
Mm-hmm.
would say like 12 weeks, unless you're a pro athlete, but then you've got some resources there. Um, Water running, though, let's say you're an athlete. If I were to get a pro athlete, I'd be putting them in the pool, pretty soon after as long as they didn't tear, once they're cleared from that, usually about 6 weeks, I'd be putting them in the pool and doing pool running. And you can do jumping and things like that there. That's completely safe. And then easing them into more land-based activities as we get closer to the 12 weeks. Other cardio, so like walking, but you can walk up a hill. You just got to breathe as you walk up the hill. You can make it
Yeah.
hard. You can walk
Yeah.
backwards. You can walk sideways. I wouldn't be doing step classes, jumping jacks. All of that needs to wait. Again, unless you were willing to like take that risk of like having a prolapse or something like that happen, or developing a diastasis, which is I just see it too often. So
Mm-hmm. Mm-hmm.
yeah, but I always say I'm going to give you advice. You take it or leave it. So it's that thing of like empowering people to make the decisions that are best for them too. So because you're going to get people in your gym who are like, I don't care, I want my body back. And you're like, okay, I
Yep.
told you.
Yeah. Yeah, we get the
Yeah,
clients. They're like, my knee hurts, and like, well, what have you done
yeah,
different? "Well, I've been running every day for the past 2 weeks." We're like, well, maybe you should tone
yeah,
down. And then the next day, they're like, yeah, I went on a 10-mile run because I ate a bunch of pasta and I felt bad. And you're like, all right, well,
All right.
yeah, yeah.
I'm
um,
Get them a
curious.
gift card for pasta for their birthday.
So there's this. I've been hearing a lot about this becoming more prevalent, but there's a thing about wearing stretch material, especially when it comes to like genital health for men and women,
Hmm.
because the stretch material has plastics in them, and they can become irritating, especially if you don't have a buffer between the genitals and the yoga pants. I'm wondering if you have an opinion on that at all, or if you're like, I just think it's a much ado about nothing kind of thing.
Yeah, we like to get our panties in a bunch, so to speak, as a culture.
Yeah, or
Yeah,
yeah, get them off, leave them off, and let everything down
yeah. I
there
mean,
shine, kind of thing.
yeah. So as far as if I'm just going to look physiologically at like the stretch response there, it's probably fine for most people. But if you're somebody who is also sitting all day long for work, or you're a cyclist and you're going to go ride 100 miles, you're probably going to end up with your pudendal nerve, your nerve through the pelvic floor, being irritated. And that takes a really long time to get out of that. So you just have to kind of look at what other things your couple versus like, yeah, I'm going to wear these to go out. Fine, you're probably fine for a couple of hours, go dancing. So you have to look at risk factors. You also have to look at, I wouldn't be wearing those 24/7. Your skin can't
Yeah,
breathe.
yeah.
You're gonna end
And,
up with some other stuff. Yeah.
and I hear a lot of women don't want to wear underwear because they don't want the line, they don't want the panty line or whatever, so they'll just kind of wear the yoga pants without anything in between, and I've just been hearing a lot that you just shouldn't do that. But
That's
you're
totally
saying,
fine. It's
yeah,
totally fine. Just
gotcha,
don't stay in those yoga pants all day.
gotcha,
See what I'm saying? Yeah. So like
yeah,
underwear, I mean, underwear, I think is as much cultural as it is like, we really look at like, why do we need underwear? We don't need underwear unless you're, look for hygiene to stay, unless you're wearing the same pants again and again, day after day, but you really don't. And a lot of my pelvic pain patients can't wear underwear. It's too painful.
hmm.
So because that pudendal nerve's irritated, so even just that pressure of normal underwear is too much. They can't wear tight clothes. So, it's fine. Just manage your hygiene, you know. Um, and again, I wouldn't stay in something stretchy and super tight 24/7 because your skin's not breathing. You're going to be put yourself more at risk for infection. And then if you couple that with other activities, you can develop the irritation of that nerve. So women, how that can show up sometimes too in women is like it feels like a UTI. It's like they have to pee or it's burning with peeing, but then half the time they'll go get tested and it's negative. Well, that's your pelvic floor is irritated. You've irritated the nerves. Or your bladder feels like something's really wrong. It's usually the nerves irritated.
Gotcha.
Yeah.
Common pelvic floor issues in men. So I think when we think of the pelvic
Yeah.
floor, we're always thinking A, pregnancy, B, women, but men's pelvic health, even as a trainer, I hardly ever hear it talked about. So
Yeah.
common things you see in men.
Well, I'm gonna back up a little bit too. I will answer this question, but I originally opened up ARIA to help women because I saw such a need. There was no clinic in our area, and I'm like, I have this expertise. I live here. I'm gonna open this. And then so many men called, and they're like, "Will you please help me?" There's such a need, and there's almost no other places in LA that are helping men. It just kind of showed me like there's this like underground almost like these issues that are really not talked about with men. They're hardly talked about with women. They're really not talked about with men. And so I said, absolutely. I've got the training. I just figured women, whatever. So here we are. And men we mostly see for frequency of urination. And this usually happens from, I get oftentimes like when I was 12, I was playing this video game and I really didn't want to get up and go pee. So like I played for 4 hours or whatever. They stretch the nerves of the bladder, and the bladder, again, we talk about patterns. It's not giving them the right signal. And so they're stuck having to go to the bathroom usually every hour or so or more frequently, or multiple times a night. So we will help with that. We get a lot of pelvic pain. So again, the burning balls are burning like in the genitalia area. Sometimes that can be low abdomen as well. There is another issue, if I can bring that up, that I told you guys about when I saw you live, but it's going around YouTube with men, and I forget what it's called, but it's basically like you're masturbating and you stop right before you ejaculate because it's supposed to give you more power or something in life, and you're supposed to bake better sales or whatever that is. That will cause you so many issues that you absolutely don't want. So I've seen people
Edging, I believe is what
edging.
it's called.
There we go.
Edging.
Don't edge, please, people. It doesn't give you any power. In fact, it causes a lot of pain. So that messes with the whole mechanism, and we've got to really like bring that back down. That can actually make ejaculation really painful. It can give you a lot of that lower abdominal pelvic pain, and again, some of that kind of like almost burning in the penis or in the testicles. So don't do that.
Just when you think you've heard it all, edging. I mean, jeez,
I mean,
jeez.
We're getting
right.
Mike and I we're getting old, so we're like, man, what are the young kids
Yeah.
doing these days?
Talk about overthinking something.
Yeah.
It's just like, jeez.
Right.
Now, I
Right. So
remember
that's
you
something.
had also brought up erectile dysfunction. I remember as
Yeah.
a pelvic floor issue, which
Yeah.
was
Yeah.
again, we never hear about that as a cause, pelvic health being related to that.
Well, if you look at, I wish I had the male model with me, the pelvic model, but like you look at where all the nerves and arteries go, it's through the pelvic floor. And so if those are irritated and they can't, we can kind of rule out the causes of erectile dysfunction. And oftentimes there's some kind of issue there. Like if the pelvic floor is too tight and it's squeezing, you can't get the circulation through, or the nerves are clamped down, that's not going to work. So we can open all of that up. We can open up the tissue so we can get that working again. And we also look at habits and things too. Oftentimes people don't realize their habits are the things that are keeping this going. And that's compiled with the physical component. So we look at sexual habits, masturbatory habits are important. We look at health habits, like how much are you drinking water, going to the bathroom, things like that. Where are you holding your stress? A lot of these things are really, really linked to our stress. a lot of our stress is held in the pelvic floor. So really looking at then how to manage stress, how to make sure it moves through the body and you're not storing it down there. So yeah, erectile dysfunction, and then prostatitis is oftentimes like misdiagnosed, or it can have a pelvic floor component. So older men,
What
prostate
is
grows
what is
forever.
what is prostatitis?
Big prostate, because your prostate just grows and grows and grows and grows and grows, and sometimes it can be a little bigger than it should be. So
Gotcha.
in that, sometimes the symptoms of urination or sexual issues are kind of like tossed aside as, oh, it's your prostate. But oftentimes the pelvic floor, again, is like this. And then you've also got an enlarged prostate. It's going to grow for men your whole life. So if you live long enough, you're eventually going to have a prostate issue. The key is to manage it and stay ahead of it. And usually it's benign as far as it won't, usually it's not cancer, but it's something that can cause symptoms. So oftentimes that's just either like not a full diagnosis or just incorrect diagnosis there. So we'll see quite a bit of that. And then other than that, yeah, prostate surgery, you can see people before and after. And then again, going back to hip and back pain. So I see a lot of, and oftentimes I'll see that in like a couple, I'll see that the wife or the girlfriend, and she's like, I think you could help my husband too, and she'll send him in. And sure enough, he's got some old injury from sports that no one dealt with fully because they're not going in that far. They're not looking at, like, externally, we'll go all the way into the groin and look at where do all your external rotators attach, right? And sometimes there's a tendonitis happening there. And again, we've got that football analogy where people, the players aren't playing the right position, so your mechanics of how you're moving are off. And internally, again, the pelvic floor is usually really clamped down. And it's just
Hmm.
been missed because people don't know. Other practitioners don't know. I mean, the pelvic floor still is something that we have to seek out as far as education goes. It's not something that has been a really proactive field. And so there's a lot of, now thankfully with social media, there's a lot more education happening to be like, this is not something you have to live with. And yes, you can find somebody. And even for other practitioners, I mean, if you're another practitioner watching, call your local pelvic floor person, go out to coffee with them, and like just ask questions, because
Hmm.
there's so much to learn, and so much that we can help people with through here.
Now,
Yeah.
so you're a guy with back pain that's been bothering you for years, let's say. When do you like going to a just a regular PT versus going to a pelvic health specialist? How does that happen? Like, is it usually they go to the PT
Yeah.
and the PT can't solve it and they go to you, or could they also just go straight to you to see what's going on?
For me, they can come straight to me, but my background's in sports medicine orthopedic. So I have an extensive background as well in that. Some pelvic PTs, depending on where you live, don't. So I would ask, like, do you also have a background in like sports and orthopedics? Then you can go, yes, directly to your pelvic PT. If not, you want to work with the sports PT and the pelvic PT. If the sports PT can't solve the puzzle, if that makes sense. So that's how that would be done, because there's just so much as far as like movement patterns go, and like spinal alignment and all of that are important.
So do you tend to see a lot of people where it's like no one else has been able to solve this yet? You're kind
Yeah,
of like,
yeah, that's
I don't
like
want to say
half the
last
people.
resort. Last resort doesn't sound good in a sense, but like you're the final one. We're like, okay, we're gonna go deeper
Yeah,
than
it's
everyone
it's
else
the
has
missing
gone.
link, right? It's the missing link, and I'm only the missing link because again, it's not there's not enough culturally in our society that have the training, right? So it's I get a lot of people who've been everywhere and they've been trying for years to solve their hip or their back pain, and then they find out about me through just Google or from a friend or something, and then it's like, oh, well, there's this giant piece that never got addressed. And so there's no way, because it's the cornerstone of like how things are moving. No matter how good your other PT is, they just don't, they won't go there. They won't even touch that part of the body, if that makes sense.
Yeah,
So,
yeah, totally.
yeah, yeah.
Yeah, and just
So
in
that,
the fitness world, I mean, it's very, very rarely talked about at all. Just in general fitness, and even having taken pre and postpartum classes and trainings, again, it's even that it's really not touched on. It's just very you get very general basics, but it's this kind of stuff is really not talked about in for trainers, and I would say for physical therapists as well.
yeah, I would agree, because most PTs do not have this training. You have your doctorate of physical therapy does not mean you know anything about the pelvic floor because it's not taught in school. You have to either be proactive about it. Like, I'm somebody who wanted to go into this before I was even in school. So like I was like, I want an internship around somebody, right, who's got this knowledge. you have to learn it all like on top of school. And so it's really important to see who you're getting your information from. So especially if you're getting it online, I don't care if they're the biggest fitness person, whatever, they've got this like postnatal class and blah, 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 blah. What's their training, you know? Or do they just have enough of a following they can slap that word on there and sell a course? And so that, I would say, like in our culture right now, that's what you really have to look at, is like, who are you getting your information from? And like your PT, like, do they have any experience in pelvic health? If not, it's not wrong. They just might not have the whole picture for you, you know? So they might be great with a knee or a hip that doesn't involve the pelvic floor, but if there's a pelvic floor component, they may not know or think to refer to a pelvic health person because they may not have worked with one before.
Mm-hmm.
Yeah.
So for the average gym goer right now, someone they're working out on their own, they're just kind of doing their own thing, what would be some just general advice? General advice. If you had your general advice for everyone out there working out on their own, a couple tips to make sure that their pelvic health is intact and they're doing some basic things to keep it in a good place. What would you say?
Breathe. Number one, breathe, breathe. We hold our breath so much more than we even realize through the day, especially again if you've got a computer job or you've got a stressful job. So breathe. Take some time to breathe. I gave you the 4-7-8 breathing technique. That's one. There's others you can do as well, but breathe. Number two, I would be moving. I would be watching your posture and really at least doing like some seated cat cows where you're opening up that spine in both directions. I do the full ones, but just really make sure you're utilizing that posture, because pelvic floor, but also like again, bad posture is not sexy, right? So like none of us wants to be that 90-year-old that's like crunched like this, but we don't realize we stop moving like that usually in our 30s or 40s. So just doing a couple of like little cat cows where you're rounding your spine and you're coming up and you're lifting your arms up, that will open up your pelvic floor and really improve your pelvic health. It actually gets circulation into the pelvic floor, but it also is going to help with lung expansion. You're going to have better use of your lungs, and you're going to look and feel better. Your spine shares the load as you move too. So I would say that's number two. And then number three, I would say keep your hips strong. I gave you that hip, like the 45-degree angle exercise earlier. That's just a really good basic one. And oftentimes it's missed if we're doing, you know, your typical, like if you're just squatting, you're not getting that, right? So you really got to make sure those are turned on. So make sure your hips are strong in all directions. And then four, flexibility is important. You got to make sure you can move, because again, especially if you've got a computer job, and then you're driving all day and whatever, we get stuck like this. Our hips don't open up, because so then again, you're going to start clamping down on the pelvic floor. You're much more likely for issues there. And respiration, breathing is usually tied into that as well. So flexibility, hip strength, really good posture and spinal mobility, and breathing. I would say those four things.
Yeah, good stuff for sure.
Yeah.
Awesome.
Yeah.
Mhm.
Yeah.
So we're almost at the end of time, but first let people know where can we find you? Where can we physically and online get in touch with Dr. Sasha?
Yeah, so Dr. Sasha, we are right by the LAX airport here in LA. So I do see a lot of international people and bi-coastal people out of New York too. We are at the Aria Life, so TheAurialife for Instagram, and thearialife.com for online. You can also just type in Aria Pelvic Health Los Angeles. That should come up. So if you've got any questions, reach out to us, drop us a DM, shoot us an email. I'm happy to answer those, happy to be a resource. I just do want to look, Lucho, you've got one more question. I don't want to ignore that. I heard men do Kegel for pelvic improvement. What's the balanced way to practice that? As a man, I wouldn't be doing Kegels. No, most men have a tight pelvic floor, and that's going to make it worse. So you don't have as many holes as a woman does. So you have more stability there inherently than women do. Usually Kegels are not the answer for men. It's usually breathing and stress reduction, number one, and then looking at posture and load management. And then bladder retraining if you've got bladder stuff. Yeah.
And no edging. No edging.
No more edging, people. Stop it. Find your power in another place.
Yes. Hi.
All right.
Do you have an Instagram as well? And,
yes,
and
at
all of
the
that?
Aria Life.
God, great,
Yeah.
great.
Yeah.
And we will
Awesome.
we'll pop all that in the show
Cool.
notes. So yeah, Dr. Sasha, thank you so much. This is great information, a much needed topic that just needs to